Hi, my name is Carmel Hauck. My student number is T00701793. This is my pre-CPR opener video to answer all of the questions. So as far as the patient position, since it's a Labrador Retriever, we want it to be in either right or left lateral. Some other breeds we would do in dorsal, but for a lab, right or left lateral. And then as far as where on the chest we are doing our compressions, it's going to end up being slightly caudal to the heart. We want to aim for the widest portion of the chest. You are going to be going at 100 to 120 beats per minute for your compression speed, and the rate of the depth is, the depth of the compressions is about a third to half of the regular depth of the chest. It's important to allow a full recoil so that you have time for the ventricles to fill up in between your compressions. And then as far as the intubation, so intubation should be performed in lateral too. It should be going concurrent with the compressions starting, so you should have somebody else being able to intubate. Once intubated, the ventilation will be at a rate of about 10 breaths per minute. They're bagged with either an ambu bag, or I had a football, we don't have an ambu bag. So you want to give a 1 second squeeze and release, and then every 6 seconds or so another 1 second squeeze, release. The monitoring equipment, so we are using is the ECG. So this monitors the electrical activity of the heart. We can watch for arrhythmias, and we can watch for ROSC as well. And then end-tidal CO2, it helps us to monitor if we're taking breaths. It helps to monitor how effective CPR is, because those numbers indicate that blood is moving through circulation. So we know that our pumps are doing something. And then we can also, again, monitor for ROSC. And then for the vascular access, so two options for that would be either peripheral vein access, so a cephalic or a saphenous, or jugular vein access is the ideal. There's also like intraosseous or other options too. And then a cut down. So a cut down is an emergency procedure where you make an incision to access the vein or the vessel. Sometimes you just slice into the skin to expose the vein, or you can also like fully excise the vein, ripping it out of the fascia below it and like fully isolate it on its own. That's like an emergency procedure if you can't get vein access otherwise. And then the alternative to vascular access would be intratracheal medication. So those would be given at 10 times the normal dose. And you have naloxone, atropine, vasopressin, epinephrine, and lidocaine would be the drugs you can give intratracheally.
Hi there, my name is Carmel Hauck. My student number is T00701793. These are my clinic mentors, Brenda, Kay, and Roberta, and I have Emily here as well. We are going to be doing our mock CPR demo today. I'm going to be taking lead, and I'm going to be directing them on their CPR. So I'm going to be first up with compressions. Brenda, I would like you to intubate, please, and then hook up the end-tidal CO2. Roberta, can you please get vein access?
Dog's intubated.
Okay, please ventilate at 10 breaths per minute. That's about 1 every 6 seconds.
Vein access in.
Thank you.
ECG is attached.
Thank you.
30 seconds has elapsed. One minute has elapsed. A minute 30 has elapsed.
Can you please draw up epinephrine at 0.3 mils?
0.3 mLs of epinephrine pulled up.
Perfect. And we're about to switch. So Brenda, you're going to take over compressions, and I'm going to come and help you there.
10 seconds remain.
Okay, Roberta, please listen to the chest. I'm going to check for a pulse. I'm checking my ECG. We are still asystole, so let's switch.
Continuing chest compressions.
Okay, thank you. So about 100 to 120 beats per minute. And I'm going to take over ventilation. Can you please push 0.3 mL of epinephrine?
0.3 mLs of epinephrine in.
So I'm ventilating it again, about 1 every 6 seconds.
Seconds has lapsed. One minute has lapsed. A minute 30 has lapsed.
Okay, so we're going to switch again here. Could you please draw up 2.2 mL of atropine for this next round?
2.2 mLs of atropine ready.
Thank you. Okay, so Brenda, you're going to take over at the 10 seconds, and then Roberta's going to take over compressions.
10 seconds.
So we're going to listen to the chest. I'm going to check for a pulse.
Continuing ventilating once every 6
Okay,
seconds.
so we're still asystole, so let's start on that third round. I'm going to push the 2.2 mL of atropine IV.
Seconds has lapsed. One minute has lapsed. A minute 30 has lapsed. Seconds remain.
All right, so we're going to check one more time for heartbeat, pulse. ECG is still reading asystole. And the owner has opted to stop, so we're going to not go on to